have Dr. Wade Smith, who's a breast-dedicated oncologist, who's here to give us our breast-linked chemotherapy report. Welcome.
Thank you for having me, Lisa.
You're welcome. And really interesting stuff that we're going to talk about today. I mean, there's been a lot of talk about breast cancer, of course. However, you have some specific things. So when you say breast-dedicated oncologist, what does that mean?
As an oncologist, somebody who treats cancers with medicines, sometimes chemotherapy, sometimes hormone therapy. As an oncologist, I treat breast cancer and maintain a practice exclusivity with breast cancer.
Okay.
And so it essentially enables me to remain more interconnected with other breast cancer specialists in the community and internationally, and allows me to provide that level of expertise conveyed onto the patient.
Okay, all right. And then we were talking earlier about treatments, and you mentioned chemotherapy. And I know there's other treatments, but there's something specific that's going on right now, and there's a particular type of study. Can you tell me a little bit about it?
Sure. Recently making headlines was the presentation of Tailor X, which is a large study looking at roughly 10,000 breast cancer patients. And of those 10,000 patients, roughly 6,700 have the most common type of breast cancer we see. And the purpose of this Tailor X trial was to determine if a gene expression test that we've been using for a long time could be applied to women who were within the intermediate risk category of their breast cancer.
Okay.
And again, a gene expression test is a test that looks at not our DNA, but the DNA of the patient's cancer cell, looking to see if there are high-risk mutations present within the cancer cell DNA.
Right.
And if there are enough high-risk mutations within this 21 gene panel, then we would classify it as either high risk, intermediate risk, or low risk.
Okay.
We've had information directing us with regard to high-risk patients and low-risk patients, but presented at the American Society of Clinical Oncology annual meeting and more recently published in the New England Journal of Medicine, we now have the update telling us how to basically utilize this test report in determining whether a patient is going to benefit from receiving chemotherapy after surgery for early stage breast cancer or not having to receive chemotherapy.
Okay. Why is it so difficult in the intermediate stage to really determine it?
Well, for one, it comprises the majority of our patients. So 70% of our early stage breast cancer patients end up falling into this intermediate range. And so it's very important to determine whether they're going to benefit from chemotherapy or not. Chemotherapy has associated side effects. It can impact quality of life. It can mean a woman will take time off of work for several months. So it's a big commitment to receive outpatient chemotherapy. And if we can spare patients chemotherapy, then it's worthwhile.
Well, that's good to know. Now, chemotherapy is not the only way to go. What are some of the other treatments?
Well, we treat early stage breast cancer with surgery. That's the cornerstone of therapy. In addition to chemotherapy, we also often treat with radiation therapy and endocrine therapy.
Okay. Well, in fact, the endocrine, tell me a little bit about that.
Well, endocrine therapy, as pertaining to women whose breast cancer has expressed the estrogen receptor, basically allows us to deprive any residual cancer cells that have survived surgery, survived radiation therapy, depriving them from being stimulated with estrogen within the body by either blocking estrogen from binding and activating the estrogen receptor, or by lowering one's level of estrogen in their own body.
Okay. Are you seeing some new technologies on the horizon that are maybe going to be better than what we see today?
Absolutely. So the big, I think, push that we've seen in the last several years has been targeted therapies. So therapies that oncologists would provide that instead of basically attacking all rapidly dividing cells in the body, therapies that are very specific to cancer cells in the way that cancer cells express specific proteins or may harbor a specific gene mutation resulting in abnormal protein expression, we're able to single out that needle in a haystack and target it better. Another new front in targeting cancer cells has been in augmenting the body's own immune system. And there have been recent treatments within the scope of breast cancer oncology that has also led to drastic improvements in outcome.
Great. Hopefully we're not too far away with some of those.
Absolutely.
All right, good. BreastLink's been around for a really long time. Tell me why.
Well, BreastLink is a model that is unique, certainly unique to this part of the country, where we incorporate medical oncology, breast surgical oncology, as well as other ancillary services all under one roof. And that enables a patient who comes in for a diagnostic mammogram to rapidly be seen by the breast surgeon, the breast oncologist, and so as to orchestrate a treatment plan in a very short matter of time and get that patient onto treatment and ultimately onto cure is our goal.
Well, and then records-wise, everything is contained, right? Rather than, I think what you're trying to say is that some of the other hospitals or things that we go to, doctors, you have to go to a variety of different places, right?
That's correct.
So then we worry about our records being transferred.
Right, and so that's the benefit of this model, keeping everything under one roof.
All right, excellent. What are some of the things that you could tell our audience about what we should be looking for? I mean, I know we always go to our yearly, but in addition to that, are there other things that we should be looking out for?
With regard to our own health?
With regard to our health, our breast cancer, or anything like that?
Yeah, I always encourage patients, if there's any seedling of doubt or concern with regard to something they discover within their own body, maybe not even necessarily a lump, but a change within their breast that is new, to go ahead and bring that to the attention of their primary provider.
Okay.
And of course, we're always available in order to facilitate the appropriate diagnostic imaging and to either provide reassurance or to take it to the next level and pursue a biopsy.
So just curious, why did you go into oncology?
In medical school, that was a time when we first started seeing breakthroughs in what would be the targeted therapies we have today. Trastuzumab, which is HER2-directed therapy that we use very commonly in breast cancer, had just started to show excellent results. And across the board, I knew that cancer could be treated in a way that moves beyond simply the scalpel and could be treated in a way incorporating medicines and targeted therapies that I think is certainly interesting and exciting from the standpoint of the investigator, but also offers so much to patients. And I wanted to be a part of that.
Okay, all right. Can you tell me about the confusion with the Tailor X study that has hit the news about women not needing chemotherapy for treatment?
I've had some of my own patients come and ask me, does that mean we don't need chemotherapy? What I will say is that the Tailor X update certainly allows us to select out only those patients who are going to require chemotherapy and leave the remaining 70 or 85% with lymph node negative early stage breast cancer in a situation where we don't have to offer chemotherapy. But what we do know from this study is that there are still a sizable percentage of patients that are going to require chemotherapy in order to achieve a benefit in reducing the risk of the cancer coming back, as well as the benefit of not dying of breast cancer. So very important to have that discussion with their treating oncologist.
Well, it's nice to know that there is a study that you can certainly help the majority of the patients. So excellent. Well, thank you. Very good information.
Absolutely.
I appreciate you being with us.
Thank you very much.
All right. If you would like more information about breast cancer or you have additional questions, you can always go to breastlink.com.